If you're an American citizen, you've been to a hospital in the last few years, you probably noticed that wait times are especially large, and very often somebody who's there in the emergency room waiting is an illegal alien, very often a person who can't even speak English. Why do those people get health care benefits at hospitals paid for by American citizens? The answer is a decision made by the Biden administration that the Trump administration, working with congressional Republicans, undid. We turned off that money spigot to health care funding for illegal aliens. The Democrats, in their legislative text, want to turn it back on.
Pretty much none of what he said there is true. To the great shame of our country, people who are here and are undocumented have not and cannot access Medicaid, Medicare, CHIP, or subsidies through the Affordable Care Act. That has been the case since 1996. It's also not true that emergency department wait times are long because of immigrants, any kind of immigrants at all. There have been a number of studies done looking at what the causes are of ED overcrowding, and immigrants are nowhere on that list. For example, this study looking at wait times in California from 2011 to 2021 found that over that period of time, hospitals were closing, there were fewer hospital beds, and there was a higher acuity, meaning the higher level of illness of patients, combined with a higher volume of patients. And it doesn't take a genius to figure out that more patients who are more sick with fewer beds and fewer hospitals will result in more crowded emergency departments. There is a tiny bit of truth in what he was saying, in that when patients present to the emergency department, hospitals are obligated to treat them. That's because of the Emergency Medical Treatment and Labor Act, or EMTALA. When those patients are uninsured, hospitals can apply for reimbursement of the costs incurred from Medicaid. Now, those expenses where Medicaid is reimbursing hospitals for patients, specifically immigrants who have received care there and were uninsured, make up less than 1% of Medicaid expenditures every year. And even though it's a very small percentage of the overall Medicaid budget, these reimbursements help keep these hospitals open so they can take care of all patients. More importantly, that whole set of comments was a giant racist dog whistle. He's trying to scapegoat people who are not descendants of white Europeans. As a physician, I can say our healthcare system is terrible in many, many ways, and a lot of which has to do with capitalism and the for-profit nature of our healthcare systems. None of that has anything to do with immigrants. Anyone who thinks we should watch people bleed out in emergency department lobbies because they don't have whatever paperwork you want them to have has coal where their heart should be, and that is my official diagnosis.
So guys, let's look at this shutdown versus healthcare. Hey beautiful people, welcome to my YouTube channel. Thank you so much for stopping by and supporting your girl on this channel. And as always, all credit goes to the creators in these videos. Guys, in today's video, Democrats and Republicans are standing on opposite sides of the same line, and neither of them wants to step back. The Democrats are saying that they will not agree to any deal unless it includes money to protect healthcare programs like the ACA and Medicaid. And they are saying that without this funding, millions of Americans will face higher insurance costs or they will lose their coverage completely. And the Republicans, on the other hand, are saying that Democrats are holding the government hostage over political demands. And their argument is that the government must reopen first, and any other healthcare issues can be discussed later, guys. And some Republican leaders are saying that they are only asking Democrats to extend the existing funding levels. But Democrats are responding by saying that if they ignore the healthcare now, it means that families will just pay the price later, because both sides are saying they care about the economy and all of that. And while this government does remain locked, guys, people are waiting in line outside. People are waiting for their medicine. They're waiting for appointments, and they are waiting for answers. And each day and each hour that passes by, guys, it's really, really dangerous. Because Democrats are saying that the Republicans are trying to weaken the healthcare system by refusing to extend subsidies that make insurance affordable. And Republicans are saying that Democrats are using the shutdown to push their own health agenda. Guys, make this argument make sense to me in the comment section. Let's see what these other creators have to say, and I'll see you soon.
When you see prominent Republicans interviewed about the current government shutdown, it's apparent they want to use this as a way to try to destroy Obamacare entirely with no replacement. Now, the key thing you need to understand about this is not only will it make your health insurance skyrocket, but those people with pre-existing conditions who have spent a decade telling our health insurance companies about that because we thought we were safe because the law of the land was that you could not be denied under Obamacare for that, will now have that information used and weaponized against us so we can never get health insurance again. Look at myself. I'm 6'3", 198 pounds, don't smoke, don't drink, 10% body fat, resting heart rate of 39. It doesn't matter. I will get completely screwed, and so will millions of other people. And the unfairness in that is extraordinary. It is inducing people to do something because of legislation and then pulling the rug out later on and then just completely screwing them so they're worse off than they were before. So this is the Republicans. They're ghoulish. They don't care. If you're not rich and you can't give them power, then you just don't matter. You're disposable.
My friend who's retired, I believe she's 67 now, just got her Medicare Advantage premium details for next year. And her out-of-pocket maximum expense went from $4,200 a year to over $10,000. So if she has some kind of emergency where she requires hospitalization or emergency room care on a retiree's income, she gets to pay up to $10,200. This is Republican policy. She lives in the state of Indiana. And this is what all the cuts to everything are doing, all the budget cuts to every state. And these are the decisions each state is making individually on what's going to be cut, who's going to have to pay more. And people think that there's going to be an end to this shutdown. You've got Caroline Levitt lying, Donald Trump lying about all these people not getting paid, all of these layoffs. They don't give a rat's ass about layoffs. If they did, they would have cared about the 280,000 federal workers who lost their job because the guy who runs X and his little 19-year-olds wanted to give so much more money to the billionaire class in tax cuts that they just stuck it to all of us. They didn't care about those 280,000 employees, former employees. And now we're coming up to nearly 1 million Americans laid off because of the tariffs, because of all the funding cuts, because of all the deportations. Almost 1 million employees. They don't care about them. They don't care about them. And to think that Republicans actually believe this administration cares about the government workers being furloughed right now over this shutdown thing. Macro view. Project 2025 wants the Affordable Care Act completely dismantled. They're gutting it. This is on their way to doing that. Once it's gutted, there'll be no more government subsidies for any of us, meaning our tax dollars being pooled collectively and then dispersed to bring down our healthcare costs. No, instead, they're going to privatize everything. So their cronies are going to make a shit ton of money, starting companies that can fill the need or just giving contracts to the companies that already exist, all those MAGA donors. And nothing will be for us. Everything will be out of pocket. We are fucked. So this shutdown is not going to end because Republicans care about people being laid off or because they care about how much we're going to be paying for health care. So there you go. In the meanwhile, look for all your premium hikes next year. And now foreclosures, it was just announced, foreclosures are at an all-time high because people can't afford to live in their homes. It's all coming together swimmingly.
I mean, even the vice president said that Democrats want funding for undocumented immigrants. And the Democrats are saying that that's not the case because this fight is about who controls the future of healthcare. Because if the subsidies under Obamacare expire, premiums could double for many middle-class families, and y'all know what that means. And Democrats are saying that this is, in quotes, economic cruelty. But the Republicans, on the other hand, are saying that constant extension of this thing that they are trying to push will cost too much and regrow the federal deficit. And while this argument is going on and on and on, clinics across the country face funding gaps. Hospitals delay programs. People that rely on federal aid don't know what is coming next. And while these politicians are going back and forth, American citizens are the ones that are paying the price for their arguments. Do you think this is fair? I don't think this is fair at all. Guys, let me know your thoughts in the comments. Let's see what these other creators have to say.
You know, I want to know when it became more important to the United States government to strip the rights from already very marginalized groups of people than to support the average American citizen. And you know, I'm saying this because this government shutdown is affecting, I want to say, almost 2 million government employees, United States tax-paying people who have either been furloughed and they are not working and they are not being paid, or God forbid, you're one of the poor unfortunate souls that was determined essential and you are working, but you are not being paid. And these are people with families, with children that need to be fed. These are people with bills that need to be paid to keep a roof over their head. These are people who need to buy groceries. But somehow it has become more important to find more tax breaks for the already very wealthy 1% than to provide affordable health care for American citizens. And you know, I do not know where this I know exactly where this confusion has come from, actually, of the right saying that Democrats are trying to push funding to pay for health care for undocumented citizens. And you know, I have said this once and I will say it a million more times. To be eligible for coverage under the Affordable Care Act, Medicaid, you need to have a social security number. You know who doesn't have a social security number? Undocumented citizens. And all of this comes down to emergency rooms. And apparently, this is true. There are people who go into emergency rooms a lot of times to receive life-saving care. Before providing life-saving care, emergency rooms are not typically checking your citizenship status. And then these people are getting care and they are not paying their emergency room bills. I want to know how many American citizens are paying their emergency room bills, because I know a ton that aren't. And you know, this is affecting such a small group of undocumented citizens, but you know who this is affecting? This is affecting single income households, people who are already like praying to God that they do not get sick because they are the sole providers for their family. This is affecting the elderly who have retired and literally cannot work anymore. And now they cannot afford their medication. This is affecting people with chronic illnesses and disabilities. This is affecting U.S. citizens, the majority of U.S. citizens. But somehow people have more hate in their hearts for undocumented citizens in a country that we stole this land. This is not our land. We are not the indigenous people of the United States of America. It is more important that we make sure these people do not get any health care than it is to support the millions and millions and millions of American citizens that this is going to affect. And you know, I'm ranting because I'm upset. But you know what? I think a lot more people should be upset. I think not enough people are upset, and that is a huge part of the issue. So I just wanted to come on here and rant. That's all.
The government is shut down, and baby, I don't give a what Republicans say, what the media has to say. Republicans did this and they are to blame. Democrats made a simple request. Cancel the sweeping Medicaid cuts, run the one big ugly law, and extend ACA tax credits so that more than 20 million people don't get slammed with higher healthcare costs. Republicans said no. Instead, they've shut down the government to protect their cuts and their benefits to billionaires. Be clear. Donald Trump and House Republicans created this healthcare crisis. They passed the largest cuts in Medicaid in American history just so they can hand billionaires a tax break. And if ACA tax credits aren't extended, more than 20 million Americans will face skyrocketing premiums, co-pays, and deductibles at a time when Republicans have already tanked our economy. So let's set the record straight. Trump, J.D. Vance, and congressional Republicans are pushing the lie that Democrats want free healthcare for undocumented migrants. That is false. The New York Times has already debunked this, along with several other very credible news sources. This fight is about one thing: whether the government works for billionaires or for the American people. That's it.
Yep, that's just it. And it's high time to start asking ourselves the right questions, because Democrats seems to be fighting for healthcare to remain a right, to remain affordable, to remain a privilege, a right, something that you are entitled to, that you don't have to sweat for. And Republicans, on the other hand, seem to be fighting to control how it's paid for. And the result is what we are seeing now: gridlock, uncertainty, and a government that has shut down, guys. Because beyond all this back and forth are real lives that actually depend on whatever decision they are going to make. Parents are there wondering how their children's treatments will continue. Many veterans, many seniors are afraid of their rising medicine costs, and they don't even know what is going to happen next. And speak about doctors that don't even know if the fundings will last. Guys, this shutdown is not just about politics, it's about people, and those people cannot afford to wait while the government goes back and forth. Because the simple truth that I've always been saying is that the ground is suffering. Americans are the ones that are suffering, guys. Because this government shuts down, the sicknesses don't shut down. And the longer they fight over this, right, healthcare being the major reason, the more lives that are going to pay the price. Let me know your thoughts in the comments, guys. I really want to hear from you. And if you have found value in this video, don't forget to like, share, and subscribe. And I'll see you in my next video. Please stay safe. Mental health is important. Ciao.